be sure that health apps are really going to be useful for patients?
I think the key thing is, like anything else, is actually speaking to these experts with lived experience and asking them, what are your unmet needs? What do you need this technology to do? How does it need to look and feel to address your concerns and to really bring patients along for the journey?
So the patient becomes an expert.
Absolutely, yeah. I mean, if you look at healthcare, who's a better expert than someone who lives with the condition day in, day out?
And so what did you do with the research?
So we looked at a group of about 1,600 apps that we'd reviewed here at ORCHA, and we wanted to look at basically how many of them had patient involvement in design and testing. You know, you'd think it'd be obvious, but how many actually did it? And then to see if that linked to objective compliance and quality and download levels.
And what was the outcome?
So yeah, perhaps unsurprisingly, the apps that had the greatest level of user involvement during design and testing did have way better compliance to best practice standards. They were a lot safer, and they also got a lot more downloads than apps that didn't. But worryingly, only about 22% of all apps did in fact involve, you know, users during design and testing. But what we did find is that apps in oncology, apps in cardiology, in diabetes, these were the highest performers in terms of including patients, but it was still less than half of patients who were actively involved in this period.
So what's your message to developers?
I think it's clear that we've seen here that the apps that score best at the top of all of those areas for oncology, for diabetes, for cardiology, are those that involve patients throughout and really do something that works for them and that matters to them. And I think it's the whole nothing about us without us. It's about making sure that what you're making actually fills an unmet need, and there's no better way of doing that than bringing patients along for the journey.
Okay.